breathing. Ever really stop and think about it? Probably not, right? I mean, it's the first thing we do when we're born, the last thing we do when we die, and in between, we do it something like 20,000 times a day, almost completely on autopilot. It's just there, the silent engine that keeps everything running.
But here's the thing. That simple unconscious act is actually this incredibly complex and delicate dance. It's a super precise trade, bringing in the oxygen we need to live and getting rid of the waste, carbon dioxide. So what happens when that fundamental process, that perfect balance, breaks down? Well, let's get into it.
So when we talk about breathing going wrong, what are we actually talking about, from a medical point of view? Let's put a formal definition on it.
Our source material really boils it down to this. Respiratory failure is when one of two critical jobs isn't getting done. Job 1, get enough oxygen in to all your body's tissues. Job 2, get all the waste carbon dioxide out. If either one of those fails, that's respiratory failure. It's a failure of supply or a failure of waste removal. Simple as that.
And that distinction is absolutely key, because it turns out respiratory failure isn't just one single thing. It actually shows up in two very, very different ways. So on one side, you've got type 1, which is technically called hypoxemic failure, but let's just call it the oxygen problem. The body just can't get enough O2 in. Then on the other side, you have type 2, or hypercapnic failure. This is the CO2 problem. The body can't get the waste carbon dioxide out. Think of it like a factory. Type 1 is a supply chain problem. You can't get the raw materials. And type 2? That's a garbage strike. You can't get rid of the trash.
Okay, so let's dig into that supply chain problem first. Type I failure is all about the lungs just struggling to get oxygen into the blood. And there are usually two main reasons this happens.
These two culprits are called VQ mismatch and shunt. Now, I know they sound super technical, but trust me, the concepts are pretty straightforward. They're really just two different ways that the all-important connection between the air you breathe and the blood flowing through your lungs can get broken.
So first up is V/Q mismatch, and this is basically a coordination problem. The V stands for ventilation, that's the air coming into your lungs, and the Q stands for perfusion, that's the blood flowing past to pick up the oxygen. In a perfect world, they are matched up perfectly. But what if they aren't?
I want you to think about it like trying to get good radio reception. Look at this diagram from our source. In that little lung unit where the VQ is low, you've got blood flowing past, but the signal, the air, is weak. The blood just isn't getting fully oxygenated. But here's the key. If you turn up the power by giving the patient more oxygen, you can boost that weak signal and force more oxygen into the blood. It helps.
Okay, so a shunt is a much more extreme version of this. We're not talking about weak reception anymore. We're talking about a complete and total communication breakdown.
Right, so if mismatch is like bad radio reception, a shunt is like the radio being completely unplugged from the wall. You see it in the diagram here? The lung unit is getting zero air at all. It's totally blocked off. Blood flows right past it, getting shunted from one side to the other without ever picking up any oxygen. And that's why it doesn't matter how much extra oxygen you give them. You can crank the volume to max, but the signal can't get through because there's just no connection.
And that right there perfectly illustrates the crucial difference for diagnosis. When a doctor is trying to figure out why a patient's oxygen is low, one of the first things they check is how that patient responds to getting extra oxygen. If their numbers get better, that points to a mismatch. But if they don't improve, that points towards a shunt.
All right, let's switch gears and move to the other side of the problem. Let's talk about the garbage strike, type 2 failure, where the body just can't clear out that carbon dioxide. So this isn't a problem with the gas exchange down in the lungs themselves, it's a mechanical issue. It's often called pump failure, because the whole system that acts like a bellows to move air, well, it's failing. The problem could start anywhere in the chain. Maybe the brain isn't sending the right signal. Maybe the nerves can't transmit the signal. Or maybe the muscles are just too weak. It can also happen when the pump is just totally overwhelmed, like trying to force air through a blocked-up airway in a severe asthma attack. So what does this actually look like in a real patient? Let's take a quick look at some of the numbers.
These numbers, they tell a really clear story. First, look at the PaCO2. That's just a measure of carbon dioxide in the blood. It's up at 72, which is way, way higher than the normal range. Now, because CO2 is acidic when it's in your blood, that buildup is pushing the blood's pH down to 7.21, making it dangerously acidic. And that right there is the classic fingerprint of pump failure.
Okay, so we've got our two main problems figured out. Either you can't get enough oxygen in, or you can't get enough CO2 out. So how do doctors put all these clues together to figure out what to do? Well, they use a few key indicators.
They can look at things like the AA gradient, which is basically a measure of how efficiently oxygen is moving from the lungs to the blood. But honestly, as we've already seen, one of the most powerful clues is simply the patient's response to extra oxygen. Do they get a lot better? That points to mismatch. Do they barely improve at all? That tells the doctor they're probably dealing with a shunt, which is a much trickier problem to solve.
So once the problem's been identified, the goal is to get the system back in balance. The work of breathing has just become too much for the body to handle on its own. So a lot of the time, the solution is to provide ventilatory support, basically using a machine to help lift that heavy weight and do the work for the body, giving it a chance to rest and recover.
And this quote from our text just sums it up perfectly. Ventilation isn't always a cure. A lot of the time, it's a bridge. It's a life support system that takes over the job of breathing, giving the lungs and the muscles the crucial time they need to heal from whatever caused them to fail in the first place.
Okay, so let's do a super fast recap of what you should take away. 1. Respiratory failure is just a breakdown in getting O2 in or CO2 out. 2. Type I is the oxygen problem, think mismatch versus shunt. 3. Type 2 is the carbon dioxide problem, think pump failure. And 4, a patient's response to getting extra oxygen is one of the most powerful clues a doctor has to figure out what's really going on.
It's really incredible to think about, isn't it? Our bodies just perform this vital, life-sustaining job millions upon millions of times, flawlessly, without us ever giving it a second thought. It's a powerful reminder of just how resilient the human body is, and of the incredible medical technology that can step in and take over when that perfect biological balance is lost.